My names are David. Sickle cell patients. It's been challenging. It's more challenging during childhood. You go into hospitals because of crisis, every small thing, especially growing up in just, because of the cooling it's made it much more harder on authors to be able to reach out to sickle cell patients and give them the medication they desire. Understand? Because there are many people dying because of small medication that's can't afford. I really want to see that stop. When I see some people, some of my peers, like it's been very hard for them. Very, very hard. I've heard of people that died just because of some simple medication they can't get access to.
My name's D. Jam with the Palm Healthcare Clinic, short Gyel.
Valsa Palm the chief nursing officer in charge of this clinic in Tahel, Tanshul village in Gyel district.
Now, as a Bantu by name, I'm the one taking care in charge of this facility owned by Cochrane.
Sickle cell disease is a condition whereby a person is born with some deficiency in the blood cells.
Some people that are with the SS usually come up crisis because the cell does not reach the amount of days before it comes to another new cell come up with anemia. They have anemia. Basically, John's because the blood cells are manufactured in the veins.
For my facility, I've not seen anything from the government. I'm speaking specifically for this facility. I don't know others. You know, we are living in a world that is whom you know. Seeing somebody is crying in pains, if you are somebody, it touches you.
No. There is none, even the non-governmental organization have not come what to talk of the government. Their blood system will never change. It's for life, and that's how they were born.
Full name is Nathaniel Dauda Solomon.
Yes, I'm a sickle cell patient. Okay. When my mother was still alive, the challenge was not that too hard and bad because she used to take good care of me by then. So, but now she's dead, and then I have to face some realities and some physical challenge. I used to go to work, like work that I'm not supposed to do, like mining. I used to go to mining to find something to survive. So I have a wife and a son. Many times I've had the crisis and I find it so hard to get money for the hospital. Sometimes I used to be in the hospital like for 1 month or three weeks like that. But sometimes if it comes easy, I used to do like 2 weeks or 1 week in the hospital. Okay, I was sick and then they took me to Jude. So by then I was left there alone for 3 days. My parents were struggling to see how they will get something to bring to the hospital. So they couldn't get it, they just left me there alone. So I wake up, I was very hungry, and then I see nobody around me. it's just people that I don't just know them, but I still borrow food from them and eat in the hospital to see that I'm okay. Sometimes I wanted to give up in the hospital. I told them not to do any treatment for me again. Let them just leave me to die. And then one of the nurse just told me that the Lord is my strength. And then I just believed that the Lord is my strength. And then she now injected me and gave me some drugs. Within some time, I now sleep. I wake up in the evening. I was started feeling better, but still I was in the pain. I was on oxygen for 2 weeks, but to God be the glory. I'm still fine now. So I thank God for all He has been doing to me. Yeah. Yes, one church around the hospital, around the, they have bring 20,000 to assist me in buying of medicine. But yeah, it's just that for now that I don't have anything good to do. But I was a student of College of Health, and now I was withdrawn, and so now I'm just I didn't pass my exam that time, so I was withdrawn.
My name's Dauda Solomon C.
Full name is Alexander Dauda Solomon. Um, Actually, I'm the brother to Nathaniel.
Well, we've been before the demise of his mother. This case was not as much as it became when after her mother's death. Though her mother was working, very hardworking woman and very caring to the family.
I always take care of him in time of his sickness. I will take him to the hospital and I will make sure that the pain will not pain him so much. And I just thank God that before he starts showing that sign of the sickness, I will observe him and I will know that he will start it from his eyes showing yellow. So from there, I decided to say, God, this brother, he started this sickness again. In the community, he first it's so bad because of the people that lives in the community. Well, I just sit down and I look at him, the people that he's playing around with. He's always like to go through the mining where he's not supposed to be because of his friend and the people that is around him took him to the farm and find this mining work. So from there, he find it so difficult in the community to understand his body sometimes.
It has not been easy though. According to the doctors, he's not supposed to do some kind of odd job that he's doing. So, but based on this, the problem of financial problem, this financial constraint, we couldn't make it up, and that also forced him to go into some kind of odd job. Sometimes when we go to treat, it is almost every year that we go to the hospital. Almost every year, the crisis will come. So many a times we spend over sometimes 200 or something thousand, and sometimes 100, depending on how the sickness comes. Not at all. Not at all. There's no assistance from the government. Nothing is coming from the government.
No, government never assists us on anything, and sometimes we pray that may God help us and give us what we will help ourselves, and we try our best to see that. What I think is to help him a good job, because the kind of job that he's doing is not good, and I know that if he gets something beautiful doing or something good doing, he will just calm down with his body and his all those kind of stress that he's been facing all over his body, and he will just be something good for his life to see that he survives.
Yeah, because the church, the church that they attended, sometimes they do render some assistance. Though the little one that we get from them, then we manage from other sources like borrowing and all of that.
I try to advise him, and I try to get some that I will make sure that I